Good afternoon and thanks for joining us. I'm Alex Maragos. Our top story this midday: after weeks of negotiations, IU Health and United Healthcare now have a new deal in place. Joining me now to discuss negotiations and the new contract is IU Health Arnett CEO Gatmaitan. Thank you for being here.
Hello, Alex. Thank you.
So let's start with the basics. What is the new terms of this new agreement?
Well, essentially the terms include that all the patients who are United members can continue to receive their care at IU Health facilities without any interruptions. We're fully in network.
And a big thing was the old contract expired December 31st of last year. What were the hurdles into getting a new contract done? Why did it take 5 weeks, I guess is what I'm asking?
Yes, we apologize to our patients for creating this uncertainty. We certainly did our best to not have it happen. The terms accepted today were essentially those that were on the table in December. We're very committed to providing the best value for healthcare that we can with quality and service. And United had suggested some terms that we felt were actually going to challenge our ability to serve our patients in the best way possible.
And IU throughout the process has agreed to continue to serve United Healthcare patients as in-network. Talk about how that decision was reached and how it affected your business.
That's a very good point. You know, we never stopped serving patients who are United Health Plan members. In fact, over 30,000 patient encounters have occurred throughout the state of Indiana with United Health Plan members since January 1, which tells us that patients trusted that we weren't going to let them be caught in the middle and have their care interrupted in any way. We know they value their relationship with their IU Health physicians, so we elected to process their bills as if they were still in network. It was an unusual step on our part, but we were just committed to not interrupt their patient care.
Under the terms of the new agreement, can you talk about anything that might change for patients, costs or length of this new agreement?
Yes, the agreement is for 2 years. It does go retroactive to January 1, so patients who did receive care in this interim period can be confident that it would be treated as in-network, as I said, for 2 years. And I think patients can just continue to expect to see IU Health improve and deliver the highest quality and the best healthcare value for their dollar as possible.
And is there any increased cost that people may have to worry about, or even reduced costs that might take some weight off their shoulders?
Individuals will have their health plan terms already in place. In other words, that's between their employer and themselves, so those terms would not be changing. We hope it will provide, again, greater value for the employers or those who are paying those premiums.
All right, CEO of IU Health Arnett, Gatmaitan, thank you very much for the time.
Thank you, Alex.